The Canadian Dental Care Plan was supposed to make dental care more affordable for millions of Canadians. The Liberals rolled out the program, known as the CDCP, in 2024, and it subsidizes the cost of dental care for uninsured Canadians with a household income under $90,000. Basic dental care, such as general exams, cleaning, cavity filling, and extractions, don't typically need pre-authorization, but more expensive procedures, like crowns or dentures, do. Dental patients and providers say those pre-approvals are frequently denied by Sun Life, which administers and processes claims for the CDCP. They say what's most frustrating is there's no explanation as to why the claim has been rejected.
I had a filling, break.
Walter Bossé ran into this problem last year. His dentist did an emergency repair on his tooth, but it needed a crown. His dentist submitted all the paperwork as well as the x-rays and an explanation detailing why the crown was medically necessary. But his pre-authorization request was denied. The crown would have cost him more than $1,600.
And I was quite surprised because the dentist was convinced it was straightforward, no reason to be denied.
A few months later, Bossé's dentist submitted a pre-authorization request for a different crown on a different tooth, which was cracked. It too was denied. In both cases, Sun Life did not explain why Bossé was being rejected.
I'm going, okay, what is Sun Life doing? They're playing games.
Across the country in BC, the NDP MP for Vancouver East has heard similar complaints from several of her constituents. In one case, Jenny Kwan's office intervened after a resident's pre-authorization request for dentures was rejected.
He literally couldn't eat. He got 50% coverage. At the end, that's all that we could do for him.
She's concerned these denials may impact people's health, as many residents can't afford to pay out of pocket. Earlier this spring, Kwan sent an open letter to Canada's Health Minister, Marjorie Michel, urging her to resolve the confusion around the eligibility requirements.
It doesn't make any sense that when dentists submit an application following all the rules, following the eligibility criteria for their patients, and they're being rejected. In the very minimum, they need to give people a real answer, an honest answer, a truthful answer, and have some transparency in that process.
The Canadian Dental Association is also asking the government for more clarity. They say these frequent denials are leading to the delay of timely care and also creating an administrative burden for dentists. Sun Life directed any questions about how the program is being managed to Health Canada. In an emailed statement, a spokesperson for the Federal Health Ministry reminded Canadians the insurance program is not free. Dentists sometimes charge more than the CDCP's established fees, so only a portion of the cost may be reimbursed. Household income determines what percentage the government pays. The remaining difference is paid by the patient. Health Canada says it's updated its explanation of benefits. That's basically a breakdown of what services are covered, what the plan paid, and the remaining bill for the patient. It's also given dentists a fact sheet that better explains the eligibility requirements. They say Canadians should be aware of the total amount they'll need to pay before accepting or starting treatment.
My dentist did mention that there have been cases where people had been approved, and by the time they went around to getting it done, their plan had changed.
Since Bossé originally applied for coverage, his household income changed. So he's putting those crowns off for now, and he'll reapply for the program next year.